Hello, everyone, and welcome. I am so excited for you all today because I am interviewing the amazing dentist, Dr. Heather Johnson from North Dakota, and she is a North Dakota native. And so Dr. Johnson has some incredible stories that she's going to share with us today about increased fertility, about getting off of some steroids, and also of an older woman that got so much energy after she got her gums healthy. So welcome, Dr. Johnson. Thank you for being here.
Thank you so much, Tosh. I'm so excited. This is going to be great.
Yes. So before we kind of get into it, can you just share with me a little bit about kind of your history as far as being a dentist and what got you so excited about the mouth-body connection? Because to be honest, I don't think most people are as nerdy as we are about it. But what really got you more interested in just really thinking about the mouth and the body and why there might be more to dentistry than just making sure that people's teeth don't hurt and look pretty?
Well, I got into dentistry. I have been practicing for, God, what is it even? I want to say almost 18 years now. And I love the preventative approach. Anything that we can do now to prevent a problem later, that's always been just a huge motivator for me in all aspects of my life. And so I think, and I love the teaching aspect too. At one point, I thought I was going to be a teacher, and then I turned into I pursued dentistry. And so I think that's the prevention part is what really drew me into what can we be doing to be as healthy as possible. And I guess as far as the mouth-body connection goes, I feel like a lot of people had, even before going into dentistry, a lot of people kind of seem like they would know or have heard how the mouth and like the heart are connected, or they might have heard about how the mouth impacts the rest of the body. But I feel like when you start talking to patients or, people that, it's like they don't really know how it connects, but they've maybe heard of it. I usually ask a patient, have you heard of the connection between mouth body or, mouth heart? And some people say, yeah, but, no one really knows. I think there's kind of like this idea out there where as long as you go to the dentist, like you're doing what you got to do. But when I really got into all of this, that is absolutely not true. If you're going to the dentist, you can still leave with periodontal pathogens and you have no clue because, it's considered a silent problem, gingivitis, inflamed gums, or gum disease, or just having these periodontal pathogens, you may have no clue. And so the more that I started learning about and then realizing, oh my gosh, this information has been out for 40 years and I just don't think it is emphasized enough. People, oh my gosh. And then once we started learning about, testing for micropathogen testing, and so many people have gingivitis, they may not realize it because if you're just kind of doing your normal routine at home, brushing, which most people that's a common thing is we brush, some people floss. And so they might not realize they have gingivitis, but when they're told, and it's just crazy. The more I learned, the more I couldn't stop learning. And when we started really trying to help heal these patients after the first diagnosis, people's lives just changed. I just think, to clarify, I've just been really into the mouth-body connection because if we can figure it out now, how can we get our mouth as healthy as possible now to prevent outcomes later? And this applies to everyone. You never know. If you don't test, you have no idea if you have these periodontal pathogens or not.
In most practices across the United States, we're just guessing. I mean, we're just looking at clinical presentation, and we think if somebody's mouth looks quote unquote clean, then they must be healthy. And so many hygienists, we get in there and start cleaning, we barely touch that gum tissue and it starts to bleed. The patient didn't experience any of that at home. And then as a dental hygienist for me, I was taught, well, that patient needs to brush and floss better. But then in my career, I had tons of patients who did a fabulous job keeping their teeth and mouth clean, but they still had bleeding. And I was like, well, I didn't learn what I should do in school for those patients because that to me felt like the majority of my patients in my chair.
I felt the same way. If you saw the gums bleeding, you would almost say, oh, you need to do a 45-degree angle, brushing, use an electric brush, press more. Absolutely. But it wouldn't always get better. It was like, always felt like there was something more, something missing.
Absolutely. Was there a specific patient that you had that you can remember that you thought, there's got to be something else going on here?
Yes, I remember her so vividly. It was inflamed around like her kind of the front area, and it would always bleed. It would always bleed. And then when she came back, it was like more areas in the region. So then after time, we tested her eventually, and then sure enough, she had these periodontal pathogens living under the gum line. And and now she's doing great. But it was just like, what? Like she's doing everything. She's flossing and she's brushing. She's using electric toothbrush. She's doing the angle. And so once we started implementing more of like the gum health prevention and just really emphasizing to these patients, this is not a dirty tooth problem. Like your teeth are so clean. This is a gum health problem, and we can figure this out and reverse it.
I love that. I love that. And just so some of our audience knows, what Dr. Johnson does in her practice in North Dakota is she uses a microscope similar to what's behind me. And so all she has to do, or one of her team members, is take a very small piece of plaque from her patient's mouth, and she can put it under the microscope, and we can actually see based on shape if those are healthy bacteria that are helping our body stay healthy, or if they're unhealthy bacteria that are not keeping our body healthy and actually making us really sick and making our gums bleed. And those bacteria, because they actually live inside of our gum tissue, not just on top of it, patients can do a great job and they're not able to brush them away. And from there, we can do lab testing to find out even more. So there's so much technology that's changed in dental healthcare that it really has changed the way that a lot of us can help and treat our patients. The other piece of this is that it's new science. And so a lot of practices are not yet utilizing this, but it certainly is becoming more and more mainstream. Next question. I want to talk about fertility because there's so much science now that is showing that the bacteria that causes gum infections and bleeding gums, silent infections, can actually contribute to people not being able to get pregnant. Fertility issues, not just being able to get pregnant, but can actually lead to stillborns and other pregnancy complications. I know you have some stories that you're going to share with us about that. So I will let you take it away. Share with me what you've seen in your practice.
Yeah, well, that's so interesting because this whole topic on fertility or poor pregnancy outcomes is what really got me passionate about all of this that we're talking about today, because it truly applied to me. I'm someone who tries to practice what I preach: brushing, flossing, electric toothbrush. I never missed a day. Flossing, right technique, everything. My gums never bled. Thought everything was doing it by the book. And then fast forward, and I'm starting to start a family. And then down the road, we had a devastation. We had a stillborn. And I'd always kind of heard about, and at this point, I hadn't started periodontal pathogen testing. I hadn't really gotten into that. But I just had always in the back of my mind, we had tried to think of every single scenario of like, how could have this happened? We looked at all the outcomes. And in the end, after time had passed, I thought, I wonder, and it was just all this. I don't even remember how it all got sequenced. But then before I know it, I started, learning about it. And I was like, I want to get a test. I want to see, because it's been known for several decades now that there's 3 of the 11 pathogens. Well, there's 11 pathogens you don't want harboring in your gums, but 3 of those research has shown are connected to poor pregnancy outcomes. And when I got my test result back, because I was like, oh, I'm not going to have any of these pathogens. I don't have bleeding gums. I do everything. I had some of these periodontal pathogens and some of the pregnancy one, and it was at above threshold. And I was like, oh my gosh, like this is crazy. How can this happen to me? I mean, this really can happen to anyone. I do not have periodontal disease. Thankfully, I was able to catch this before these pathogens had caused all this destruction. And so from there, I felt so passionate. I just thought, oh my gosh, I wish someone would have offered this testing to me. I think so. I'm so passionate when I have really anyone in the chair. If I have a young female, I always share. I just said, I am so glad that I'm crossing paths with you, especially if their gums are not healthy. I explain, I don't know if pregnancy is something down the road that you're considering, but getting your gums as healthy as possible, pathogen free, is going to be so important for if and when you do consider a family. And so that was my personal story that just lit the fire. And of course, it's not just fertility concern, how these periodontal pathogens can affect a negative outcome. Of course, there's more, and we're going to get more into that later. And so, yes. So now as I see women, we talk about that. And I've had many patients, but one woman in particular, her gums she didn't even realize she had gingivitis, but you start measuring the gums and and the gums were really bleedy. We took a slide, a plaque sample. We saw all those shapes of bacteria that we know just aren't healthy for a healthy outcome of like a healthy body. And we did a microbe test. It came back, all the pregnancy ones above threshold. And she left that appointment and she just said, "You are giving me hope." She was in tears. She was just like, I never knew this information. So I gave her different resources. And now that she knows about it, she's getting it reconfirmed, because the information is out there. I just don't think it gets talked about enough.
Yeah.
And so now fast forward that we got our husband in, because we know that bacteria, usually partners share the same bacteria because it passes through saliva. So through a kiss, sharing a spoon, sharing a straw. And so we got partner in there, tested. Well, fast forward time and they were able to get pregnant. So of course you never know, but I think we really increased her odds. And she had tried for over a decade. And so anytime we see each other, she's just, we have a special connection.
Absolutely. How could you not? I just love that. And I wish so many more people would know that if you're doing a great job keeping your teeth clean and you're not able to get pregnant, there might be a mouth connection. There might be bacteria that at some point you came in contact with. We all come in contact with all kinds of crazy stuff here and there. We don't necessarily know, but for me, even as a dental hygienist, after I got out of college, I truly thought that patients that had an infected mouth, that had gingivitis or that had periodontal disease would look really bad, really bleedy, would look really inflamed, and would look like a quote unquote dirty mouth. And in practice, they don't. So many people's mouths and gums, they rate, and yet they can still harbor these bacteria. So if we're not testing it's so important to get the husband and the wife and both partners, because even for getting pregnant, we know that with men now, it's 50-50 to try to get pregnant, right? And so if a man has those periodontal pathogens, they can affect his ability to get his wife pregnant. And so it's so important. And even when you're pregnant, wouldn't it be so great to just know that your oral health is excellent before you get pregnant? Because as a woman, we know that pregnancy, we don't always feel very good. It can be hard to keep our mouth really clean. And then when baby arrives, it's pretty busy. So it's not like we're going to have more time in the bathroom to be getting ourselves shined up.
Well, and just one thing to say on that, having that spouse come in is so important. I remember a situation where when we had the spouse come in, his gums looked awesome. I did not see bleeding, and I kind of thought, well, he's probably fine. But in the back of my mind, I'm like, test, don't guess. I was trained on that. And then his report came back and I was like, oh my gosh, he has them too. So it's some people have these rock star immune systems, and then and it's just wow, his immune system must just be really strong because his gums look at this moment healthy. But I'm so glad that we tested him, because he would have just given it right back to her. So it's crazy. It's awesome.
Love that so much, Dr. Johnson. Thank you so much for sharing both of those stories. They're incredible. They're incredible. And this is our everyday patients. Okay, I want to get to a couple more stories.
Yes.
Because the other ones are just as incredible. I'm going to jump to the patient that you shared with me about. I think it was maybe over a year ago now. I don't know. We've been friends for so long. And so you had a young woman that had been on steroids. She had a lot of rheumatoid arthritis flare-ups.
Hmm.
And when she came in, she had no idea. I didn't think she would realize that she had gingivitis
Mm-mm.
and she had all these medical items. But I'm going to let you share her story and the success of really getting her gums healthy.
Yeah, oh my gosh, I have so many stories that just, this one holds a special place in my heart because she was just in a couple weeks ago again too. Yeah, so she has rheumatoid arthritis and she just lives in pain and she never knows when she's going to have a really bad flare up. So she's not even that old. I want to say she's like mid 30s. And when I first met her gums weren't the healthiest. And again, she didn't really realize because I think no one really knows what normal is. And, even like the coloring of gums or if gums are puffy, it, they kind of just think they're normal. And so it's like we raise awareness and once I let her know that, and then I show, if we were seeing some bleeding or like the coloring. And long story short, we went through it all. And yes, she had gingivitis. Her slide didn't look healthy. We tested, it showed the periodontal pathogens. So we taught her, the preventative strategies, how to reverse that gingivitis so that reverse that bleeding. And she was so motivated. And I think she thought, oh my gosh, this is something that, because I was telling her, it's like a 3-tier approach. Like what we do here is really important, but what you do at home is just as important. Then of course your immune system, like how fast you're going to heal. We're going to do what we can today to reboot everything, a good flush out. And then we gave her the tools of what she could do. So anyways, fast forward time, she started just her next appointments. Her gums, just the next time her gums looked so much better. And then the next time so much better. One point along the line, we had her spouse come in, get tested. So now they're both healing together. Okay. So, and in the beginning, she used to be kind of a little fearful in the chair. A lot of patients come in with dental anxiety. Okay. She appears to have no anxiety. She comes in, she's like so happy to see me, smiles. My gums aren't bleeding when I, floss or soft pick. I'm water picking every day. And she's like, I feel so much better. She said, I never used to plan hardly anything because my flare ups would come all the time. I never knew when and when I get a flare up, it just like would knock her out. And she was almost living, she started living her life, not planning much because she just felt like she'd have to cancel everything so anyways, she's like, you will never guess this. She came back after a summer. She's like, I signed up for a marathon because I knew that I was going to, and she ran that thing. She's like, and I had no flare ups. She's living her best life. Her medication changed dramatically. It was awesome. Yes, they decreased everything. I can't remember all that, but yes, they changed them. So she's hardly on anything. And she has she says she really has no flare ups. This was the last time I talked to her. She has it's like over a year now, no flare ups. She ran a marathon and she's just the happiest. It's like she has hope again. That's what patients are telling me. They're like, I feel like I have hope. It's great.
I
Yeah.
love, well, it's one of those things that if you don't know that there's constant inflammation in your mouth because it
Mm-hmm.
doesn't hurt, there's so many people have no pain. They have minor inflammation
Right.
and don't realize that chronic inflammation is also chronic infection. And their physicians don't know necessarily to ask, is your oral health optimal? And even if they did, how do we define an optimal oral health? If you haven't had a microscope slide or a lab test, you don't necessarily know. There are other signs of health, of course, no bleeding, nice tight gum tissue, very pale pink. But sometimes those little critters are hiding below the surface. And how amazing for her to just feel like she has a new lease on life. I mean, this could completely change who she is. Like for
My
years.
gosh. Yeah. And even just her whole, her energy about her, it's like I'm talking to a different person. It's amazing. She's just like pulling that curtain back and she's living life to the fullest.
I just think about like how much happier her friendships are, her
Mhm.
marriage, or just everything. I mean, it's all connected. We're all connected.
Absolutely. And, I say it every single day, healthy mouth, healthy body. We got to get this just right so that, it's just going to decrease inflammation and it's just setting you up for long-term success.
Absolutely. I love that. And now on to the next story. This one just tickled me. I think when you texted it to me, like, I'm pretty sure I had tears in my eyes because I had not heard a story like this before. And so it just blew me away. So you had a patient that was, I think, in her mid 80s, and she came in and she was just feeling kind of sluggish and just assuming that it was because she was getting on in her years. But you found something completely different going on.
Yes, this was a really interesting story. So she is from my town, but she had lived in a big city. I think she was living in Minneapolis for several years. And so when she was living there, she was getting her teeth cleaned once a month. That's just not a common recall. But she was trying to do everything she could because she always just kind of, I don't know, it was almost like she had like this gut instinct about her mouth, but she wasn't, they were saying she was losing bone, but they thought this was the answer. So anyways.
Losing jawbone that supports her teeth?
Yeah. Yeah. Like the x-rays were showing that she was losing the jawbone, like on her bite wings. It was over years. And so they thought, just come in regularly. And she was brushing, flossing. Okay. So we met and I took a plaque sample and microbe tests, and she had periodontal and pathogens through the roof. And this is someone that was getting their teeth cleaned every single day. But I don't think public knows that there's different types of cleanings. And we just need to make sure that the patient is getting recommended the right type of cleaning, because we're just doing a regular cleaning, like we call it a prophy.
Like a polish, yeah.
Yeah, it's just, I tell patients that's like cleaning the gunk off the teeth. Well, this woman, and that's what this woman was getting, but this woman needed help underneath her gums. And so we shifted how we cared for her. And then we treated her pathogens, and we got her on a home care regimen that involves gum health too. So water pick, soft pick. Oh my gosh, she healed so great. So then we have her in for 6 to 8 week follow-up. At that point, she was feeling so good. Because sometimes it can take a little time. I mean, it doesn't ever take like crazy amount of time usually, but if a person's lived with these types of bacteria and that's been their normal, I tell patients we can't just assume you're gonna just fight it in a day or in a week. Everyone's immune system. But typically, don't you see, Tosh, that people do, once they do the home care and we make the diagnosis and we get them on the right path, like their gums are some of the fastest healing tissue in the body. The bodies want to heal. It does seem like usually people get pretty quick results.
Yeah.
But anyways, this woman, at her 6-8 week check, she was like, I feel great. She had so much energy. She said, I was so tired before. She said, I just would feel like I had to take a midday nap for an hour and a half because I just could not move my body. She was sore, but her big thing was her energy. And she's like, I mean, it was almost like, it sounded like she was almost like hyper because she's like so excited. She's like, I now can read all the time. She has, I have so many books I've wanted to read, but I get so tired and I'm reading and I'm doing my arts and crafts. Like she is living her best life in her retirement. And she's come numerous times for her recalls and she's just so happy. And she always talks about all of her energy, and her daughter has also mentioned it, just how great her mom is. It's almost like her mom is this, like, just another energy about her. It's like their whole demeanor changes. Her body is healing.
Well, to be running around with an infection for probably decades that she didn't.
100%.
I mean, to lose jawbone that supports our teeth, that is just that chronic inflammation over time. And it happens very slowly over time. So she probably had her infection for decades, but her previous doctor, they just didn't know what to look for. They were doing the best they could, clearly recommending a 1-month recall. They were really trying, but just not quite hitting the nail on the head, so to speak, of what truly we needed to do. Earlier, you mentioned that 3-tier approach of what we need to do. So I just wanted to give the audience a little bit more clarity there. So when we talk about truly getting somebody healthy and the different types of cleaning, when we're doing like a traditional prophy, you go in every 6 months to get your prophy. what we're trying to do there is just clean your teeth, remove any debris, and it's preventative in nature. I always talk to my teams about it's like, why do you wash your hands after you use a public restroom? Because you might have some germs on there that you don't want to get sick. So that's your prevention. You're not sick, you're just prevention, checking everything over, ensuring that you're healthy. So when somebody comes in every 6 months, like that's our job to make sure that they're healthy and to let them know if there's anything that could prevent them from health, whether it be teeth, gums, airway, all the different things that we do. Then when somebody comes in for therapy, there's a big difference there. So share with us what your therapy in-office protocol looks like kind of in a nutshell.
Yeah, in a nutshell, when we recommend therapy, it's because someone has, inflamed gums or gingivitis. And a lot of times they didn't realize it, but then when we show them and show picture, like we have a mirror and we're showing them, even to a light touch of your gums, they should not bleed. If you put a little soft pick, like they look like little Christmas tree tips. If you put those in between, your gums really shouldn't bleed. And if they're bleeding, that's a good sign that we're probably not very healthy with our gum health. And so we explained that therapy would be recommended here because it's no longer, like you said, Tosh, a healthy mouth. If it was a healthy mouth, we're seeing mainly above the gums where you kind of get all that gunk off the teeth, polish them up really good and, tell them to keep doing what they're doing. But we got to shift something because we can't expect tissues to improve if we don't change anything. So we recommend the gingivitis therapy in that situation, which, yes, we're still cleaning the teeth and getting, the gunk off the teeth. But the gums, that's the concern here. To address the gingivitis, I always tell patients, the bacteria in your mouth, they get really smart. They go in places in those nooks and crannies underneath the gum line, in those nooks and crannies where the toothbrush floss just can't reach. And so when we do this type of therapy, we need to flush those areas just under the gum line in those nooks and crannies. And so in our office, we use ozone water for cleanings, meaning water that has extra oxygen in it. Because what we know is the bacteria that hides in those nooks and crannies just under the gum line, they're what we call anaerobic bacteria, meaning bacteria that don't do well in oxygen. And so when we use our water, our ozone water, the water that has extra oxygen in it, and we're flushing in those nooks and crannies under the gum line, they don't do well. And so we're just kind of helping get them out of there. It really helps reset the immune system. And then just to make sure that the patients are comfortable, we do use some like numbing creams. Usually that does a really, really good job. So we usually don't need to use a needle for numbing, which is a bonus. But we call it gingicaine, but some numbing jelly. So we just do a really good flush out. And then, of course, their home care that we talked about, that 3-tier approach we did with that therapy was really good with that irrigation, just with that ozone water, reset things. And then we give our patients, talk about the home care. I always want to send them home with a sheet of everything we talked about. So we talk about it. I write out like sizes of a soft pick, how to use a water pick. I demonstrate it on a model. I have the patient demonstrate it. But then on my handout, I also have a QR code. It's actually a Vutash.
Where you had a water pick and brush.
Yes. And so, so then they have their guide. They know what they need to do. And then we generally, because I think patients usually feel, or they've heard, or they think that they get their teeth cleaned every 6 months. And so, but that I really try to emphasize that doesn't really apply when you have gums that aren't healthy. And so when we're in therapy, I say that's our goal at some point, but you're not quite there yet. We want to see you back in 6 to 8 weeks. Let's check healing. Let's make sure that your side's looking better. You don't have that your bleeding is reducing. And then I like to touch base because now they've really been doing home care and they have better questions because they're, like little things. And then we kind of go from there and decide, what their recall is. But yeah, so I think the big difference with therapy is that we got to address where those bacteria are hiding.
Yeah.
In those nooks and crannies just under the gum line. Patients do well though. They aren't, cringing, like we're keeping them comfortable.
Yeah.
That gingicaine really does help.
And so many of these infections, I mean, I think you find this too, just like I did. It's not like a really dirty mouth. I mean, some people, may
Mhm.
have taken a dental sabbatical, for various reasons. And some people do get some hardened debris that, maybe takes a little bit more elbow grease from the dental hygienist. And we have lots of methods to help make sure that they are really comfortable. But when we're talking about strictly an infection and we're going after just, bacteria, not so much the debris. Yeah, it's that those numbing creams are really, really effective just to make sure. I kind of compare it flossed in a year. It might be a little tender, and that's
Mhm.
kind of how it would feel for us. Like as we're getting in those nooks and crannies, it's kind of like flossing after you haven't flossed in a year. It's not horrible, but it's not
Right.
that either. So you might as well use the numbing cream just to make sure as
100%.
flushing out and cleaning everything out, we're good to go. That second tier, of course, is all on our patient. It's using that water flosser, really breaking up that bacteria, using an antimicrobial, then whatever else your dental professional recommends. I mean, all of us are a little bit unique. It's going to look exactly the same. I certainly am like everyone gets a water pick kind of a gal, just because it blasts the bacteria so well underneath the gums. A really awesome toothbrush technique. And then for that immune support piece, and some of our patients are really healthy and they just, got an infection and we can get them healthy. And we don't really have to lean too hard on that immune response. But other patients need a little bit more help. People do well with probiotics and prebiotics. Sometimes we even use limited antibiotic with a challenging infection. So understanding what this infection is actually being caused from, like, why does somebody have this in the first place and what do they have helps guide us so much more as professionals to have a targeted approach. And I love that so much. And I know your patients, like you just have so many that have such incredible success stories of they understand that I'm not just going to see a dentist or a dental hygienist. Like this is truly part of my overall healthcare routine.
Absolutely. Absolutely. I feel that when we take this approach, patients see things. It's like at first they might not, it's kind of new in a way, thinking about all these things that we're saying because they haven't always been heard this information. I feel like our culture is really all about, or our society, it's like what we do to keep our mouth clean is we brush and floss. We brush and floss. And most people brush. They don't always floss, but they let you know, brush and floss. And so I've really tried to rewrite that narrative and explain, brushing and flossing is still really, really important, but that's really for your teeth health. At some point, it's not enough for your gum health, and your gums will suffer because we've talked in the past about the crazy percentages in our country of how many people have these pathogens and where that we get them from. But anyways, I could keep talking about it. So
I love it. Well, my last question to you is for anyone listening that maybe their dental practice doesn't have a microscope or they can't come up to Grand Forks, North Dakota and see you. What should they ask their dental professional about their gum health? So, if maybe they can think, I don't know if my dental practice does salivary testing to look for the microbes, or if they have a microscope. Is there something that they could particularly ask their dentist or their dental hygienist to help to verify if they're healthy or not and what else they can do for themselves?
yeah, I think the number one thing, even if your office isn't, like you said, Tasha, like offering the microscope and saliva testing, I think it's really, really important to ask whoever cleaned your teeth if there was any bleeding. And not just when they measure, but when they're actually cleaning. You
Yes.
could just say, I just have a question. When you were at any point, did you see any of my gums bleed? Even like when you were cleaning, when you were, touching them or cleaning them, were any spots bleeding? And if they say yes, there's a really good chance that something's not quite right. And so really, really think about what you can do for your gum health. And it's going to take more than brushing and flossing. Tasha and I, we love the water pick, water flosser, but you got to angle it under the gum line to really break up that bacteria. But don't you think that would be a good number one thing to ask?
I think that's perfect. I think that's perfect. And the sad truth of the matter is that, for myself, when I graduated, if I had a patient that had a little bit of bleeding, it really didn't get me too hyper because unfortunately, even Listerine of all places, did a study and showed that 90% of the world's population had some form of chronic gingivitis. And I don't recommend Listerine for anybody because there's better stuff out there that's a lot more gentle. But if even Listerine is saying 90% of the population has some form of gingivitis, what causes gingivitis? The person doing a bad, poor job on their home care. It's that you came in contact with some unhealthy bugs, and those bugs thought that they found some great real estate in your mouth and they wanted to stick around. And so the water flosser is great because it breaks through that biofilm. And truly, this 3-tier approach that you were talking about, Dr. Johnson, I mean, it's what we're going to do for you in the office, you can do for yourself at home, and then what else the patient anyway. So we all have the ability to take more control of our health if we know the right things to do. On my website, I have a little guide with these QR codes that Dr. Johnson was talking about, and we'll link those in the show notes. So if you want to take a look at your technique, you can watch those quick little YouTube videos of the right angles for the water pick, the correct angles for brushing technique. And truly, if you do those things, even make them 5% better, that's a huge difference.
Mm-hmm.
Sometimes it's just the smallest tweaks that can make radical differences. There's supplements, there's all kinds of great things that we can do, but start simple and start with the techniques, I think, too.
Absolutely. That QR code is huge because I think so often people, when they try the water pick, they don't always know. They think they're doing it right, but technique is huge with those. I find that a lot of my patients, if they come back and they still have bleeding gums, I have them show me how they were doing it. And they're like, the water is just like the water pick is just set right at their teeth. So then I say, that's really what your toothbrush is doing. You really have to angle it in that to flush under that gum line. So just that video on your website is going to be really huge because a tiny little change can make a huge difference with your gum health.
Yeah, I love it. Well, this has been so much fun, Dr. Johnson. I hope you will come back and chat with us again because your stories are so inspiring. They seriously melt my heart. I mean, there's been so many messages over the years of your wins that literally make me tear up because I'm just so happy and so proud of you guys for doing just the most incredible job for your patients. They're so fortunate to have you and you're just an incredible leader. So thank you so much for your time today.
You're welcome. Thank you for having me. This has just been such a great opportunity. I always love chatting with you. You inspire me. And I am so passionate about this. I could talk about it all day long. So anytime you want me back, you tell me what we want to talk about. And I just love chatting about it because it really, truly makes a huge difference. And I just wish the whole world knew about this.
That's the goal here.
Thank you for listening to Mouthy Matters. If this episode helped, I'd love it if you shared it with a friend or left me a quick review. It really helps the show grow. And if you want a simple next step, download my 6-minute guide. It's in the show notes. We'll see you next time.